Hello, and welcome to this special session on surviving ovarian cancer, presented by Overcome. I'm Jenny Agata, and I'm a patron of the ovarian cancer charity Overcome. I joined Overcome because I care deeply about the experiences of women with ovarian cancer, after it affected someone I knew. We appreciate that ovarian cancer is one of the less common cancers, but sadly, the majority of women who develop it are not diagnosed until it has already spread, making it more difficult to treat successfully. I hope once you've listened to our volunteer presenters speaking about their experiences, you will have learned and retained vital information about earlier diagnosis that will help you in your future careers. This programme, Survivors Teaching Students, is being run by Overcome thanks to the generous support given by the family of Lisa Jane Clark, who trained as a doctor and who died of ovarian cancer. Lisa was a medical student like you. She qualified and rose to become a consultant in emergency medicine. She was a music fan. Coldplay was her favourite, and she volunteered for the Festival Music Service, where she was the clinical lead providing healthcare for festival goers. It was at Glastonbury in 2011 that Lisa first felt unwell. She suspected she was pregnant, but investigations showed that she had ovarian cancer. Lisa died 15 months after her diagnosis, aged just 40, leaving behind her husband, her 2-year-old daughter, and her heartbroken parents and sisters. She had not recognised her own symptoms of ovarian cancer. Overcome hopes that by hearing from women themselves, this presentation will help you to recognise the signs and symptoms of ovarian cancer. We want you to listen and learn from them so that during your professional careers you will be more able to diagnose women earlier and give them a better chance of survival. So thank you for attending today and for supporting the work of Overcome.
Gentle, loving, cheerful.
She was a very caring person. As a daughter, she always put us first, probably ahead of herself, and was always very, very interested in what we're doing, how we're doing. She looked at the person and not just at the disease, and that was her sort of forte, really.
Lisa's decision to become a doctor evolved over a period of time. She worked as a volunteer in the hospital locally, and it was a natural fit, really, with her personality. She didn't find it easy to qualify to even get into medical school, and she was just so excited when she had got accepted. She became a consultant and realised all her dreams in that, and we were so phenomenally proud. It's a day we will never forget, going up there, right? For her presentation. She was amazing, and she was just so chuffed.
She started with Festival Medical Services, and they were a charity that supported the services, medical services on site. So she was the clinic lead for that. At Glastonbury, when we knew there was something serious, Coldplay were playing at the time, and she couldn't go down there because she was just too ill. She was in pain with the chest and her legs?
Backache, yeah.
Backache, all sorts of things.
And bloating, wasn't she, as well?
Yeah.
So.
Thought it was pregnancy. It got worse in just 2 or 3 weeks after Glastonbury. And she left her work and went to a private clinic and had her own x-ray done and diagnosed her own cancer. And from then on, the doctors do a good job, because within 3 days she was on the table having a major surgery. And then you accept the illness, and we know that she has to go through chemo, and we supported her all the way through that, and we think she'll get better.
When you read statistics right at the beginning, you Google search this, that and the other. And I really thought she was going to make it because she was younger. And I thought the statistics were saying she would have a few years with us.
Called us to the beach hut. And she said, "Mum and Dad, I'm dying. They're withdrawing treatment." She said that to many relatives of patients during her work. And she said it so coolly to her parents. And that was it. I am dying.
She wanted to be aware of what was going on. Therefore, the pain was very bad, but she wouldn't take probably enough drugs to combat that. She really fought hard.
End of October, we go to hospice for a blood transfusion.
It was the beginning.
And the doctor said, "She's only got a few days left. We can't believe it's happening to us." And she can't believe it's happening to her.
No.
And there she is, she's saying, "I wanted more time." And she sat in the hospital bed, writing birthday cards.
For Lucy.
For Lucy, yeah. Up to the age of 21, every year. And she didn't even finish those.
No. Right at the end, the last time Lucy would have seen Lisa, she says, "Okay, Mummy, you go to sleep now, night night." Yeah.
And that was it.
And of course, and Lisa didn't. That was the night that Lisa died.
In Lisa's last few days, I asked her what charity would she like the offering at her Thanksgiving to go to. And she said Overcome. She really supported what they did, and she got some support from Overcome.
She wrote a paper in which she described how beneficial it is for real people with real problems to go in front of the camera and explain to students how they felt and their symptoms.
It all comes down to the early diagnosis. If you have the diagnosis earlier, then you've got a chance of surviving and some better treatment coming along in the future.
And Survivors Teaching Students is one of those modes of information that might just ring a few bells in the future with medical students when they qualified. We hope so.
Mm.